had to note the date and time of when it was opened. Okay, so now that my sterile field is set up, I am ready to go ahead and start cleaning the wound. I'm actually going to start measuring the wound first, sorry. Go ahead and put on a new pair of clean gloves. I have my applicators over here ready to go with the ruler on it. So I've opened a new applicator, and I have my ruler ready. I'm just going to measure the length, width, and depth, and I'll make a note of it when I'm finished with the procedure. So this one is about 12 centimeters in length. The width is about 3 centimeters. I like to throw this one away and use a new one for the depth. Do the depth and double check for undermining or tunneling, just to be sure. And the depth is also about 3 centimeters. So once I have assessed the tissue, the skin, everything inside, the appearance of it, I can go ahead and throw away all my gloves. And now I can go ahead and get ready to clean it. So I'll go ahead and take my sterile glove pack. Okay, I'll go ahead and wash my hands really fast. Open up the sterile gloves. Okay, for this one, I'm going to take my non-dominant hand, and I'm just going to hold the outer cuff, which will go on the inside of the glove. I will pull this one on. Once it's on, I can just scoop the inside of this cuff and put it on my non-dominant hand. I can pull this one down all the way, make sure I'm not touching anything but the sterile part of the glove. I can scoop it down and assess or kind of reposition if I need to. I don't want this one in my way, so I can touch the sterile part of this, scoop it up, and throw it into my biohazard bag. I'll make sure it doesn't overflow. Now I'm ready to go ahead and clean the wound. So I can just rinse this out, and then I can just start cleaning it. The cleanest to the, I guess, dirtiest portion of the skin. Swipe it once, throw it away. Moisture. Rinse it once, throw it away. And then without touching the inner tissue, I would just clean the edges of the wound, throw away, and now I'm ready to dry it. So I have my sterile field here. I can just take a dry applicator or gauze pad and dry the wound. And I'm still not touching the skin or anything to contaminate my gloves. Okay, so now the wound is cleaned and dried, I'm ready to go ahead and pack it. So I have my one gauze pad in here. I'll make sure it's not too wet, it's just moist. I will unfold it and fluff it up a bit so I can pack it. And then I have a sterile applicator in my field I can use to pack it and to make sure it doesn't touch the outside of the skin, which is contaminated. I'm just going to loosely pack the wound up until the edges. Okay, once that is done, I can go ahead and throw my applicator away, and I can put dry gauze over it. And just place it on top of it. Okay. Once the two dry gauze pads are on top, I can take the ABD pad and place it over top of the wound, the blue side facing up or away from the skin. Okay, once that is on, I can go ahead and throw away my sterile gloves because now I'm just going to tape it and make sure it's secure. Throw these in the biohazard bag. I have my tape and pen here. I will just put my initials, the date and time, so that the next nurse doing the change will know exactly who and when it was done, or who did it. So now that I've already wrote on this part of the gauze, or the tape, and it's all secured, I would go ahead and start cleaning up all of my supplies. Make sure the patient's in a comfortable position and safe position, bed in the lowest position, bed rails down, call light in reach. I'd go ahead and wash my hands, make sure they didn't need anything else, and then I would come back maybe 30 minutes to an hour later and reassess their pain and see how the dressing is doing, make sure it sticks, and then I would just document and record everything that I found.